Hypnosis to Change Your Life with Dr. Steve G. Jones.
The question was, have I treated fibromyalgia with hypnosis? And if I have, share my experience doing this. Yes, I have treated many different types of pain with hypnosis, and I've had varying degrees of success. It really depends on the aptitude, the hypnotic aptitude of the person. And again, we talk about the Harvard scale that they developed with Stanford, of the scale of susceptibility. I hate that word, but I prefer suggestibility. But at any rate, the Harvard scale of susceptibility, as it's called, puts everyone on a number scale, how likely you are to go into hypnosis. So in order to fight pain with hypnosis, you have to have a high level, a high aptitude for hypnosis, because you need to be able to maintain a hypnotic state during your everyday life, which can be challenging. For some people, it can be like juggling and running a marathon. It can be a little bit of a challenge. But if you have a high hypnotic aptitude already, or if you have a reasonable one that can be worked with a hypnotherapist, then you can have tremendous success with blocking pain. And the way I like to do it is just the old breaker box technique, which has been around forever. I didn't invent it, but I use it. So you picture in your mind that you have a breaker box, and these would be huge breaker switches, but you know, in a house you have that panel, you open it up, and this is for the kitchen electricity, this is for the first bedroom electricity, this is for the pantry electricity, and so forth. And you have an on-off situation on each of these switches, except that instead of correlating to the pantry and the kitchen and a bedroom, they correlate to your left arm, your right arm, your left leg, your right leg, your head, your torso, something along those lines. And instead of being just on and off, you can have a graduated scale where we have degrees from this would be 0 and this would be 10. And so when you really feel the pain, it's cranked up to a 10, and in your mind you can bring it down to a 0. Eventually, after a few sessions of working with someone, you can just switch it off. But you have to usually start out with some kind of scale that they're going down and going up also, so they can feel it becoming more intense, so they know this really works. That's easier for a lot of people to turn it up at first. Then they turn it down, and they get good at turning it down, and then they just turn it off. That takes time, that takes effort, that takes work. I used to work at a drug rehab place called Echo Malibu in Malibu, California, and this is about in the year 2002, I believe. And every now and then we'd have a patient who would have a situation. And one time I had a patient who was hooked on drugs. He was hooked on painkillers. These were usually celebrity patients who would go there because they charged a lot of money there. And this person was hooked on painkillers, and he wasn't able to not feel pain unless he took the painkillers. He had a tremendous hypnotic aptitude though. So I was able to work with him over about 6 sessions, and he was so good at hypnosis already, and by the time we were done, he was an expert at controlling his mind and dialing that pain down and then just switching it off. And I would test him. I would throw things to him, little rubber balls. I'd throw them to him and have him throw them back. And I'd have him do this, and we're talking about session 4 at this point. I would have him do this while at the same time he's turning that off, just to make sure that he could do his daily functions, driving a car, brushing his teeth, walking around, buying groceries, and also turn this off. So it's not good enough to just be able to do it in an office when you're sitting down and there are no distractions. You have to introduce distractions eventually. And but those with a good hypnotic aptitude can actually control pain very well.
Hypnosis to Change Your Life with Dr. Steve G. Jones.